Welcome to Jay's Corner. My name is Jay O. I'm the author of Maximize Your Medicare. I'm also an education fellow at the Alliance for Lifetime Income. You can find all of that information on the Substack, jo.substack.com. Be sure to go there. That is your place to get all the information that I'm sharing here today, plus a lot more. Paid subscribers get special access to videos and information that I'm not able to share in public. There's a lot of reasons for that. I am the highly regulated. I have people and organizations to protect. We're going to get into that as we go here. This is always about you. This is not about, one size fits all. It reminds me of one of my favorite movies. Hopefully you've known this scene. If not, please go see it.
Which one is you?
What do you mean?
I mean, which one is you?
None of them. They're just pieces.
This is you.
Absolutely. Absolutely. I can't even tell you this, right? Which is that you can see through the common thread is going to be always that I'm going to be talking about the base case and picking apart things that are not really revealed, shared with you in a way that you can understand in clear, actionable ways for you. Nevertheless, the fact is that you need to tailor them to your individual situation. I want you to, so that you can get the best outcome for yourself. Don't forget, in the text below today's video, there's a link to a form to receive free Medicare guidance. It's a real simple form. All we have to do is fill it in. I'll be back to you within 24 hours to get the journey started. And here we go here. So let's just get right into it. Medicare mess. I titled that the video here, and every piece of data, every input I get, every piece of insight I receive, information I receive leads me to this conclusion. I can't come with any other conclusion. Just eliminate what's not possible, and and then what you end up having is what's going to occur. Right? The old Dr. Spock from Star Trek. And Sherlock Holmes, from what I told. I didn't read Sherlock Holmes. So a lot of it has to do with, the base case and KFF report on Medicare. I will include the link. I think I've done so in the description here about how complicated the situation is. 66 million people on Medicare. 66 million people on Medicare. And you can understand here on Jay's Corner, Maximize Your Medicare channel, KFF is very frequently used, both in positive and negative. I have thrown rocks at it, but make no mistake, this is top of class, right? I wouldn't spend time, giving credence to the underqualified. This is the highly qualified, top of class, as I stated. So shout out to them, of course. And now they give a very good brief overview about the kind of current state of play, meaning, what is it, who's covered, and you can see it here. All of this stuff, obviously, in Maximize Your Medicare. And you'll see the size of the issue here, which is the share of U.S. adults who at 65-year-old projected to go from 17% to nearly a quarter in 2060. And as you can see it here, 60 to 93 million in 2060. Now that's a long time away, right? But you can still see it here. Even here in 2020, here's where you are. You're talking about half the population is between 65 and 74. And so now you can see it here, which is the state of health. We'll get to a GOVI shortly, but you can see it here, which is half of all people had incomes below $36,000 a year. $36,000 a year in a time when you've had Cheerios at $7 a box, right? And so now you can understand my point. This is simply your takeaway here is you can understand why I'm this even-handed when examining Medicare Advantage versus Medigap. It's very easy and convenient to say Medigap always because it is the superior standardized grandfathered contract. That is true. true. Technically speaking, as a contract, all the parts don't move. That is in the buyer's favor, period. Okay. That said, it costs money. And that money is money that many people simply, from a practical point of view, do not have. The example in Jay's Corner I like to say, you're the old man who lives in a shoe. You have 700 children. You don't know what to do. You live on Social Security alone, and you are never sick. Guess what? Medicare Advantage, for all the noise and crossfire around it, is the rational, reasonable selection you would make. Now, that has an asterisk, right? You still have to deal with network. You still have to understand the fact that this is annual contract. These things that I'm reviewing in Maximize Your Medicare so that you can understand what you are signing up for. Again, it's a common thread through Jay's Corner, which is I'm not going to tell you don't take any risk. Risk is everywhere inherent, uncertainty inherent. That is just part of waking up in the morning. I get all of that. It is the unintended risk that I'm trying to help you avoid. From there, if that's your choice, that's your choice. That is your priority. I'm not here as your clergy person, right? Or personal philosopher, philosophy guidance counselor. That is not my role here. I'm not trying to be that. I am trying to be a person to give you clarity so that you can be empowered to choose for yourself. And now we go on and you can see it here. Very, very clearly, this is why Medicare Advantage simply cannot go away. Right? You've got too many people at $36,000 a year. Half of 66 million, that's 33 million for those keeping count at home. So now we can talk about some overview of Part A, Part B, Part C, which is Medicare Advantage. Here it is. And now you've got prescription drugs. We're going to get into that here. And we're going to get into the physicians here. So anyway, I'm not going to keep going on to it, but it was my main point about the Medicare Advantage, why it is not going away. It's important to understand it, especially for those people who face financial challenge, of which there are many, many. The other day, I recorded a snippet with Bob Powell, and this is the second one, retiree health insurance. And this is going to, for those people who have worked for large companies as well as governments. And here is what we said, and I'm not going to play the entirety.
In 2024, a majority of states will offer Medicare Advantage plans to their state retirees. And here to talk with me about that is Jay O, author of Maximize Your Medicare. Jay, welcome.
Thanks for having me, Bob.
A pleasure. So, a new trend developing for state retirees.
Actually, I think it's just coming into the news, Bob. It is reasonable, it is rational. You can understand that state, local governments under tremendous fiscal pressures of their own, and you've had entire retiree systems where the money came from tax dollars being switched. For example, very famously a number of years ago, Texas teachers entirely. The retirement system was switched notably, leading to something like tens of thousands of people instantly leaving the retiree health benefits program. So what has happened is instead of the health insurance packages or plans that they were used to, accustomed to, which mimicked kind of the plans when they were active employees, that those employees, once retired, get converted to Medicare Advantage plans. And this has caused controversy just due to the crossfire regarding Medicare Advantage plans alone. And let's stop it here. I'm going to turn on the camera. So rather than, continuing on, what I'm going to do is give you my comments here, which is that this is not news, right? Which is that retiree health insurance converting to group Medicare Advantage. And this is the takeaway, right? Which is in New York State, for example, they're trying to do set people up in arms, lawsuits around. The reality is it would save the entity, New York State, City of Chicago, State of Illinois, they have saved a lot of money by converting people to Medicare Advantage and still trying to say, okay, we are doing right by our retirees. It is the rational thing. This is the point of healthcare cost planning generally, which is the crossfire. The stakeholders are not irrational here. No, I would not make that statement. Now, whether or not the question is how you are going to be accepting it, how you take it, right? And for some people, this is going to be a blessing, right? Because the fact of the matter is that retiree health benefits may have had a cost, and those costs may go down to zero, other than the fact that you have to be enrolled in Part B. So that is absolutely here, but it then points out my point here, which is that it means, so in Maximize Your Medicare, I go through Medicare Advantage. Just because it's group Medicare Advantage still makes it Medicare Advantage. Now, that means that all of the other matters have to be understood. Annual contract, understand the network first, understand your prescriptions is usually included and can be look and feel different than a standalone Part D plan. And then there are extra benefits. All of those are all still true within group Medicare Advantage. That also means, and this is why I think it's going to be a mess, which is that the payments to Medicare Advantage are flat at best or down, right? Depending on who you ask. And who does that affect? That affects who? The carriers who are trying to assemble the jigsaw puzzle to create Medicare Advantage plans. And they've already told you. They've already told you. You've had earnings reports now. And it's not just one carrier who's just like incompetent. No, that is not what is happening. What instead is happening is the list has just, everyone has taken the podium and everyone said the same thing. Humana, United Healthcare, Aetna, the biggest. They've all said the same thing. That the squeeze in putting together this jigsaw puzzle is difficult, challenging, but yet competitive, which has worked hugely in your favor, right? That's why silver sneakers is included. That's why dental and vision is included, etc. Light dental and vision can be included in your Medicare Advantage plan. Simply put, what it was is that the sellers, the carriers, are taking their allowance, something that I've explained in the past in videos on Maximize Your Medicare channel. And they have allocated, and then, oh yeah, by the way, they know they've got a very competent competitor across the street. 7-Eleven, Circle K across the street. There's a reason I use the example of the fact that I'm just wearing a 7-Eleven smock. Right? I'm not changing the price. That's not legal. Right? There's no massaging of the contract from someone like me. That's just like not even a topic. What is the topic, however, is the CEOs are warning you. Let's continue. It's going to get worse. And part of that input has to do with the Inflation Reduction Act. So, how can I put this nicely? If I were Gen Z, I understand the phrase #OKBoomer. And the reason is simple. That the Inflation Reduction Act is basically ARP wins. The end. Which is next year, in 2025, you're going to have a $2,000 out-of-pocket max for Part D. That is incredible. This single line alone, which I have highlighted the entire time that I was dealing with the Inflation Reduction Act and educating people, informing people on what the provisions were, is on that alone. Now all of a sudden, you can understand my place, my corner, right? Which is your estimates of cost here now have been capped and certain. Both. So you had some $10,000 a year medication. Guess what? So now it's 75% off. So now it's $2,500. Even that has gone down from $2,500 to $2,000. And oh yeah, by the way, you don't worry that the next year it's going to be $4,000. Even if the sticker price of the medication goes from $10,000 to $20,000. You are capped. It is a huge win for existing Medicare beneficiaries. I don't think that there's any way to sugarcoat it or state it otherwise. Just don't. The issue is the feedback loop, right? The feedback loop is back up to here, right? Which is, you're the adolescent child, you got an allowance, you didn't have any say. And oh yeah, the government, your parents just said, oh yeah, by the way, you can only buy 3 big gulps with your allowance. That's it. And now you got to, or for actually better stated, you have to buy at least 10 copies of hardcover books. I'm going to give you this allowance and you can do what you want, but you've got to do this. Well, that's the Inflation Reduction Act, right? The stuff that they're going to require in Part D and Medicare Advantage plans is going to be tougher, a lot tougher. And then we have Wegovy. So over the past couple of days, or over the past month or so, I spoke with Bob on thestreet.com, Retirement Daily. Please check it out, thestreet.com. Robert Powell, legendary financial journalist, absolutely icon, is Wegovy's use for hypertension. So quickly, I will tell you, right? You cannot just go up to your primary care physician and go, hey, I would love to drop 20 pounds. Can you prescribe Wegovy for weight loss, even though I'm Mr. or Miss Perfect? No, that will not work. Okay. You can only have Wegovy for specific medical condition, and the doctor has to put their name to it. I'm going to stop comment from there. Now, the issue is that Part D and Medicare Advantage plans have to take this into account in their allowance. Right? This is a $400, from what I understand, $400 a month medication. So now you've got to make this fit in your allowance. Again, we're back to the balancing act. And then, of course, as I've stated above, and I've told this to people, and I'll share it with you privately, right? And I've said so in the past, right? Doctors are taking a pay cut. So if under original Medicare, just red, white, and blue card alone, right? The doctors are currently, right now, today, have taken a pay cut. And now you can understand why I wrote Maximize Your Medicare, because I'm like, look, the bottom line is you can do everything that you want for yourself. Eat well, exercise, no Jack Daniels before 8 a.m., whatever you want from a lifestyle perspective and habits perspective. There are certain things you simply don't control. And this demographic and fiscal reality, right, which I've now highlighted for you here, right? These are things you do not control, but yet do have a role in your decision making and understanding. Both. I knew it was going to be. We had a lot today. Let's just continue here. So the impact on consumers, then, of course, should be self-evident, obvious. I like being Captain Obvious, right? I'm not a good salesperson. I don't like making coin flip sales. That makes no point. The impact on consumers, and it has never been a good idea, but I think that what you are going to see is when we provide our counsel or guidance to people, we say, okay, given your inputs, here's the efficient solution, which is the ultimately the cost minimizing solution where you still get to access the healthcare providers that you want to, based on your situation, location, age, the whole kit and caboodle. All at once, yes, that's true. The issue is since all of the cards are going to be shuffled as a result of this top section here, because of this top section and all of these factors being moved around, the ones I have highlighted in green, the only rational conclusion is that the impact on consumers is going to be high. And the reality is that this year we have seen it. We have seen it, but not to the degree that we will see it next year. I think that next year, like I said, that's why I called it a mess. I just don't see any logical, rational way, other conclusion for that. And don't get me wrong, while today is not a pity party, right? The impact on myself and other financial guidance people involved in Medicare matters is not going to be zero. Is not going to be zero. You will see less. You will see less commercials. I don't think that rightfully or wrongfully there are going to be less. Right? There's wrongdoing. The rules are understood. There's usually a very good reason for rules. I think that's going to be the case. That's true. There's a way that you don't get called by tons of people on Medicare matters. You should not be getting unsolicited calls during this time of the year, especially if you are already enrolled in Medicare Part A and Part B. That is not legal. I've already discussed how to avoid fraud, which is simply ask the person, tell me your NPN number. And then they can't transfer the call to another party. Those two alone shut it down a lot. That will cut down on a lot of the problems. That said, there are still problems. I've told this to people on the newsletter. I'll say it again here today, which is certain carriers are going to be paying people like me zero for the guidance that I provide. Now, I believe in doing the right thing. That is first and foremost. That is true. And that will always be true. Right? This is like these other standards like fiduciary suitability. I just kind of shrug myself and think, what other standards are there? That's like crazy to me. But they must exist for a reason. I don't know what they would be. But for example, that is part and parcel from over here. That said, the issue here is the following. Is I'm out there a lot. And now, as I stated at the beginning of today's presentation, I'm sitting there not only protecting my book, but I'm also protecting my colleagues at the Alliance for Lifetime Income, which include the ex-chief economist of Social Security Administration. Hello. Shout out to you, Jason, right? I mean, which is simply that, and he's not alone at that caliber of professional experience. He's not alone. So I sit in a room of like 17 of us or something like that, right? I'm not there to risk them either by association. That other role is too important at too high a level, right? I'm just a guy, a private citizen, who wrote a published book. And so on top of the insurance carriers and the states that I have to follow their regulations, what I'm trying to get to you is the following, which is that does not preventing someone with the, Mr. or Miss entitled and thinks that all financial people are evil, complain, I've got to set down all my work just to swat it away. I'm not going to do the wrong thing, but the burden of proof then wrongfully shifts to me. Now, the reason I went on this, tangent is I'm fine with that at low pay because I believe in doing the right thing. but not at zero. And now any reasonable person can understand that balance. So I'm going to be having to make tough choices. I'm not 23. If I were a new college graduate and I had no book of business, had no other resume, had no other experience or affiliations, guess what? I would probably provide that guidance for free and take the risk. That's not the case here. And with that, you can understand the point here, which is, let's go to the second segment, which is I'm going to be speaking at the Financial Planning Association annual conference. So, for example, and for the reason I put here is not to flex at all, right? I People can look on About Me. That's totally fine. I will. True, I'll stand by it, no problem, right? I don't like to talk, to be candid with you. I am an introvert in public. The reason is I don't want to go down the wormhole of talking about what I do or know and hear some distortions about financial stuff, and then I have to say, oh no, and then I'm a jerk. Well, take a number. Lots of people think that. That said, that is different than being underqualified. That is different. This is the description to that annual conference. And, I kind of went, oh, and et cetera, probably. Anyway, 1,500 is 60 speakers. So there are 60 of us. Apparently, I'm headed to enemy territory, to Columbus, Ohio, home of the Ohio State University. I'm gonna find some sign and delete the IO and State University and just put the O, and then it'll be correctly spelled. But and then I'm also thinking about playing "Hail to the Victors" as background music during my presentation. I'm not just for fun. Then again, this is going to be a serious thing. As I apparently this is a serious thing.